Alexa TV presents in 3, 2, 1. Dateline Schools with your host, Terry Harrington.
All this week on Dateline Schools, we're learning some tips to help make this a great, healthy start to the brand new school year and to give our kids the opportunity to have a successful year. And to give us our tips from the St. Clair County Health Department are Jennifer Michaluk and Margaret Sturgis. And Margaret, yesterday we just touched on real briefly immunizations and how important that is with school. We got about 4 weeks left. It's probably a good time for parents to check their kids up and see where they are, isn't it?
Yes, definitely.
Okay. What are some of the immunizations that our kids need to have heading into this school year?
Well, parents need to make sure that all children receive all the immunizations that they're due for, so they need to check with their physician or the health department to see that they're up to date. But middle school kids, those who are 11 to 12 years of age, do need some booster doses. They need a Tdap, which protects against diphtheria, tetanus, and pertussis. They need a shot that protects against meningitis, and they also need HPV vaccine, which protects against certain types of cancers. Teenagers that didn't receive those when they were 11 to 12 can still get them, and they just have to have their parent call a healthcare provider to set up an appointment.
Are those updates mostly for those kids going from the elementary level to the middle school this year?
Yes. Well, kids do have to have required immunizations at the preschool level and at the elementary level, but there are new recommendations or requirements for 7th graders.
Now, you mentioned, too, that a lot of them are for 11-year-olds, so we've got a few 10-year-olds coming from 5th grade to 6th grade. They may have to wait a little bit, right?
Well, they could. When they turn 11 is when they're recommended, but now they aren't required until 7th grade, but we still recommend they receive them when they turn 11 years of age.
What about for those kids making that jump from middle school to high school?
Well, those high school kids that may not have received those, they may still need them, and we do recommend that they do receive them as well. They just need to see a healthcare provider to get caught up.
And Jennifer, if a parent's not sure what their child needs or if they have all of their immunizations up, how do they check and find out what they do need?
Well, like Margaret had mentioned, they can call their healthcare provider and they can look it up in a special system called MICR, or they can call the health department as well, and we can do that for them as well.
Now, are the doctors also tied into that system so they have the same records?
Yes.
We'll be back with more tomorrow. For Dateline Schools, I'm Terry Harrington.